Our next speaker is Dr. Lieve Lynen, and she and her husband have been working in Africa for many years, 7 years in Zambia, a year in Malawi, and 17 years in Tanzania. They're now based here in Arusha, been working with tick-borne diseases, and she is going to speak to us now on East Coast Fever Immunization. Please give her a very warm welcome, Dr. Lynen.
Thank you, Mr. Chairman, ladies and gentlemen. I know it's the last presentation of the morning, so we try not to be boring and we try to keep it short. Now, I'm going to talk about East Coast Fever Immunization, mainly targeting the pastoralist livestock sector, but we're also going to discuss a little bit on smallholder dairy and dairy. The picture you see here, unfortunately, has been taken several years ago. For those who are here and want to see a little bit of Tanzania, Kili, unfortunately, has no longer so much snow. So this was a lucky picture. Now, who are we? Both me and my husband, we are veterinarians. Since 2001, we have started our own company in Tanzania. And from 2006 onwards, we do also on-site running a veterinary clinic and mobile units to go out in pastoral areas, mainly doing ECF immunization. If you can see, we have always been, since 2003, involved in this. Even I met some old friends from Zambia. Already in Zambia we were doing, and we were both of us involved in ECF immunization. Bepi has much more experience outside this corner of the world because he also worked in Ethiopia, Somalia, Afghanistan, Pakistan, and most recently he was in South Sudan. So this is where our background is from. Now, for those who are not livestock people, East Coast fever is a tick-borne disease which is transmitted by the brown ear tick. It causes very high mortality, up to 100% in improved breeds, and we're talking about dairy, commercial dairy, smallholder dairy, commercial beef. But in Tanzania, even in the indigenous zebu livestock population, it causes high mortalities in the newborn calf crop. We're talking an average up to 60% of every calf born in 1 year will die from East Coast fever. Okay? If the rains are very good, we're talking almost up to 90 or 100% mortality. So even for the indigenous livestock sector, East Coast fever is a serious threat. The good thing is that once an animal survives East Coast fever, it is immune for life. And that's what the whole ECF immunization is targeting for. Oh, sorry. If you look at economics, for Tanzania alone, Tanzania is losing every year about 45 million US dollars to control East Coast fever. And most of these costs are direct losses due to mortalities. Animals are dying. Okay? On the other hand, in the smallholder dairy and the dairy sector, we also have huge losses in milk production. Now, because it is a tick-borne disease, of course, there are the control options. We have in the past, and Africa as a whole has been targeting ticks. We're doing acaricides, we're using them. For the smallholder dairy or a dairy, you are spending up to $25 per animal per year, something you have to repeat for the lifetime of the animal. So it's costly. Tick-borne disease treatments are available. Unfortunately, again, East Coast fever, you need to treat with parvacone, buparvacone, the most expensive drugs in the gamma of tick-borne diseases. You know, you're looking for an adult dairy animal up to $70. And the treatment only works if you do it at the onset of clinical signs. So most of the farmers are too late. They're first trying to raise the money to buy the drug. By the time they have the drug and treat, animal is still going to die. The third option is ECF immunization. And there, we're talking about $6 to $12 US per animal once a lifetime. You don't have to repeat every 4 months like you have to do with Newcastle. You do it as quickly as possible, as soon as possible. And we're targeting animals or cows born as from 2-3 weeks of age. Those are the ones we're targeting for ECF immunization. Tick control is in Kenya very well maintained, unfortunately not in Tanzania. Private farm, commercial farms which have a good dip tank, tick control still works if it is done correctly. Problem is in the pastoral sector where no facilities, shortage of water, poor acaricide use, it is not very efficient. And there are very many, both environmental and human safety issues related to the use of acaricides, pesticides in the whole. The big problem in Tanzania and in Kenya, we don't know, we don't have figures about Uganda, there is a huge problem of acaricide resistance. And the colleagues of Australia who have now left, they know what is the problem of tick resistance or acaricide resistance with the ticks. Tanzania, and these are figures from 10 years ago, we had more than 40% complete resistance against the brown ear tick. And that's the one that is transmitting East Coast fever. So we are losing the battle against the ticks. And we should try and focus our control methods to other options. East Coast fever vaccine, it's called infection and treatment method, because what we're actually doing, we are infecting the animal. We are injecting live Theileria parva sporozoites. At the same time, we are treating with a long-acting oxytetracycline. So we infect and we block. And we give the body the chance to build up an immune response to the vaccination. Now, we are talking about the Muguga cocktail, which is used in Tanzania. It is a cocktail because it comprises 3 different isolates. There is the Serengeti transformed, which is the Tanzanian strain. We have the Kiambu 5 and the Muguga, which are Kenyan strains. So we have what we call a regional cocktail. Okay? Now, in Tanzania, we've been using this vaccine since the mid-90s, and it gives more than 98% protection against field infection. So this is one of the veterinary vaccines, besides the rinderpest vaccine, which is the most efficient to be used in the field. This is how it is produced. We have 3 different isolates which have different characteristics and different strengths. So they are put separately in groups of animals. The ticks are put on those animals and they pick up the infection, and then we actually go and look in those ticks on how strongly or how heavily infected they are, and then we pool the ticks so that what is in the end the trivalent cocktail, that all the strains are equally represented when we use it as a vaccine. Now, on one of the first maps, we show the East Coast fever distribution in Africa. We are looking at 11 countries. We start with South Sudan, which is a more recent problem area, going down Uganda, the DRC, I'm going to do the short names, Rwanda, Burundi, Kenya, Tanzania, Malawi, Zambia, Zimbabwe, Mozambique, and in South Africa there is a bit of a problem with East Coast fever, but related to the areas where you have Cape buffalo. So it's not really a disease that has moved into the livestock population. But if we look at this map, and we're looking at where is ECF a problem, we all know that with Ethiopia, Sudan, and Tanzania, those are the 3 countries with the highest cattle population in Africa. Tanzania alone has almost 19 million cattle. Rwanda and Burundi, due to security problems, they lost the stocks of the strains they had. They are now, at the moment, doing no field application whatsoever. Kenya was using for a long time the Marikibuni, which was a local strain, but also that they have abandoned that approach and are going now for the Muguga cocktail. But if you look at Tanzania, we are sort of spearheading the delivery of the vaccine. By now, we have done over 800,000 animals have been vaccinated. Kenya, 30,000. Now, how did it all happen in Tanzania? You know, it's been a process, and even with the Newcastle disease process, Robin said, people want to see that you vaccinate the animal and it doesn't drop dead when you do that. That was also for us the first step. You had to vaccinate, and if the animal actually survived the 30 days, then they said, oh, you're not killing my animals, fine, we will try again. And it's on the long-term benefits that they see, oh, my animal is surviving, my animal is much bigger, much stronger, I get many more cows, I get much more milk. The adoption was a 3 to 4 year process, once you initiate it in some regions. Okay. Now, in Tanzania, we had a long process of testing and evaluation, which was completely project-driven. There was a regional FAO-funded project. 1995, the government of Tanzania gave the green light to please go for field application, so that's when we started. And to 2003, it was completely project-driven. Then the government had the sense to realize that they would not be able to continue this without donor support in the future, and they tendered this out to give it to the private sector. Trying to give the responsibility to the private sector to continue this job because donor funding was drying up. So from 2003 onwards, we as Vedagro, because we had started the company, we tendered for this distribution and the delivery of the vaccine. We won it at that time. We've done it on the 3 years with a memorandum of understanding. So we were more like a liaison between the gradual handing over from public project-driven to private sector approach of ECF vaccine delivery. 2005 was a drought year. 2006, we lobbied with FAO at the time. Please, we need support. All the calves have been dying. we need somebody to help us fund ECF vaccination in 2006. They did it, and you see there an enormous increase suddenly to almost 100,000 animals vaccinated at $1 per animal. The farmer only had to pay the delivery price. The FAO had paid for the package. 2007, everybody says you're going to completely crash because nobody is willing to pay the full commercial price, which was $6, $7. If you can see from the map, people are willing to pay. It was not that they were not willing to pay, it was that they they did not have access to this vaccine. So as soon as we broadened the access and the knowledge of the people, suddenly everybody was coming forward and was willing to pay for this vaccine. And they are paying the full commercial price. 2009, 2010, again, was a severe drought year. People from the region here know. We have reports for northern Tanzania. 80% of the pastoral herds perished, 80%. What often happens after a drought, that you have a bumper calf crop. So 2011, my Maasai friends were very happy because there was a booming of calves everywhere. And we did a record number of 126,000 because everybody wanted to make sure as soon as a calf was born, it needed to be vaccinated. They were all rebuilding herds and doing restocking, so they wanted to do vaccinations. So 2011 was a very good year for vaccination because people wanted this and they were desperate to make sure that they were securing the survival of their calves. There are challenges involved in this. Of course, the government, sometimes it's easy to say, let the private sector deal with this, but we as a private sector are only a small company. We do not have a monopoly, but we don't see other players coming to help us in broadening the access to this ECF vaccine. Sensitization of the end users is still a problem. We have a very nice video which we will show you later, and we are enjoying ourselves a lot together with our friends to do these film shows in Maasai land. And at least the message is getting out, but more support is needed to do that. We have a problem, though, with the delivery agents. They are trained people in Tanzania, veterinarians, animal health assistants, diploma holders. As long as they have been trained in proper handling of this vaccine, they are allowed to do the delivery. The problem is that in years or in times that the Maasais are desperate and they're willing to pay even more, people take advantage because they're putting themselves in a vulnerable position. So we have problems with the delivery agents in the field taking advantage of the fact that people are willing to pay for this and misusing that confidence. And that is something it's difficult to deal with, and both parties or all the stakeholders have to look into this. Okay? Public-private partnership is all nice wording, but it has to work. So there are conflicts arising there. At the moment, ITM in Tanzania is a private good, so the private sector is pushing it. We accept all that after a big drought, it should become a public good. But the stakeholders who are carrying this in the private sector or area, they should be involved when it moves to the public sector. If that doesn't happen, of course, you have conflicts. Okay, as a distributor in Tanzania now, we are facing serious financial problems because it's out in Maasai land. To get your money where it belongs is not always easy. And on a regional basis, we still have strong sort of research interests which hamper implementation of this ECF vaccine in some countries, not in Tanzania, luckily. Now, Veragro, in trying to pursue this, okay, we need to give access to the vaccine. We need to make people aware of this vaccine and how well it works. If you look, the Memorandum of Understanding with the government was signed in 2003. At that time, related to the US dollar price, we were selling it, and that was regulated within the memorandum, $4.6 US. We are now 2013, and we are still selling it at $4.6 US. So we are not trying as a private company, and there we say we are not a private company, we are an NGO. We are trying to broaden the access to keep the price affordable, but of course we are offsetting a little bit, lower profit margins, but a broader market adoption of the vaccine. But at the same time, the liquid nitrogen cost, OTC, and that has all increased. So we're trying to play it in a way that we are still pushing the adoption in the market without making it not affordable for the people who are involved. Now, if you look across the region and just East Africa, there are a complete difference in farm delivery prices. Tanzania, to bring it, the Maasais are paying between $5.5 and $7 US per calf vaccinated. For the dairy, the price ranges between 8 and 12, but if you look at the Kenyan prices, they are already much higher. Uganda is not doing much in the traditional sector. They're mainly looking at the dairy. There, the last knowledge of price we had was $10, which is partly subsidized. Okay. So what's happening, of course, between Kenya and Tanzania, that we have all the households across the border coming to Tanzania to get the vaccine, which is fair enough also because in Longido district, what we are looking at here, there has been a long tradition now of doing every 3 months ECF vaccinations. So it's much more easier for the Kenyan relatives, households to come across the border and have access to the ECF vaccine. Now, if we ask the pastoralist assessments, and on the video we show you later, that is mainly what I want you to listen to. We're going to look at what the end users have to say about the vaccine. Not about how much money we make or how much money the delivery agent makes when he does the job, what the end user wants of this. Okay? Now, you have to understand, if you have 60% of your cows dying each year with the ECF vaccine, which only needs to be done once a lifetime, you have no more ECF cases. The Maasais are saying that the only cows that die are the ones falling in the Karongo or getting bitten by the snake or taken by the hyena. Those are the mortalities they're talking about now. So suddenly you have all the calves surviving and you have plenty of milk, because an East African zebu does not give milk if the calf is not present there to help with the milking. Okay? So suddenly we have plenty of milk. They have much better growth rates in the calves because an ECF survivor gets stunted. It clinically doesn't look well. It's not a healthy animal. Because we vaccinate them and it's a controlled infection, the calves grow much better and they're much bigger than the same age groups which are not vaccinated. And because they are much better and because they all have this ECF ear tag, they get very good prices at the markets, even as a calf. They are fetching double the price from a normal animal which is brought to the market. So it gives added value to the fact that these animals were immunized. They are reporting to us, and of course we're not doing no projects on fertility in the Maasai herds, but they're all reporting that the female animals are getting pregnant much earlier, meaning that they are maturing much faster. Okay? But what is the most nicest development you see in the Maasai areas now is everybody wants to buy better breeds. There is a huge influx of Borana animals, of Sahiwal animals, of Mpapa breed, because suddenly they can keep them alive. There are so many more imported and good bulls coming in from, a lot of them from Kenya, from Uganda, to start doing better breeding, better beef quality for the local Maasai animals. Okay? And in some areas, especially Sukuma land, they see a very much advantage in moving ECF vaccinated animals in new areas for grazing. There is a bit of a shift in how they do the management of the grazing, because suddenly they have access to areas where in the past they were staying far away from because they knew it was a high-risk area for East Coast fever. So suddenly they have more choices and more options on where they want to go with their animals. And because all these cows are staying alive, they are selling off. Everybody says, no, Maasais don't want to sell, they want to keep as many animals as possible. I'm sorry, this is a myth, it's not true. We have in Longido, where we have almost 80% adoption of the ECF vaccine, we have a 20% offtake annually of the herds. So people are more than willing to sell the cold cows, the old animals, the sick animals, and they're willing to sell calves because they have more than enough milk. They don't need all the calves, they're actually selling off calves. So there is a huge offtake. That means that there is money now suddenly available for school fees, for medical care, all the other things they want to do. They are not increasing agriculture for those agriculturists who are here, but what we see is they're improving. They're going for mechanization, they buy the tractors, and they use more work oxen. So instead of increasing the amount of agriculture in the Maasai areas, we see a better use of the land and how they do agriculture. So we have made posters, and we have some leaflets which have been handed out to try and express to other people what is the importance of ECF vaccination on all of this. And this is something you will hear in the video from the end user directly. But what we feel is that any policymaker should keep in mind the impact of ITM on poverty reduction, on improving livelihoods. Robin earlier mentioned the 8 Millennium Development Goals. I'm not going to read them for you, but just glancing at them, the target of the Millennium Goals was 2015. The 8 goals were agreed upon by all the nations which were present at that summit. If you look at ITM, we are touching each and every one of these Millennium Goals. Now, our question is, if we have a technology which is available to address and actually to help us reach these goals, because we are not reaching the goals. The goal has already, the target has been postponed to 2030. Why? Now, with ECF vaccination, we feel we have an excellent tool to actually push and be able to reach these Millennium Goals. So we feel that is a bit of a failure of the international community. Why Newcastle disease is funded? I have nothing against Newcastle, but why are donors not interested in the big ruminants and livestock? There is a fatigue with the donors saying, big ruminants, livestock, it's long turnover, not very successful products or projects. Fine, but we have a successful product. Why are donors not jumping on this and actually assisting in making it more accessible and affordable to the people? So, this is our question, and we are struggling with the concept because most recently we were in South Sudan. And in South Sudan, Sudan is a new country, is recovering from a civil war. It's 90% pastoralists. They had no ECF problems because if you look at the yellow stars, ECF was endemic in the equatorial states. There was meaning that there was almost no mortality, no clinical disease. So what happened now? 2005, with the signing of the peace agreement, all the South Sudan cattle came back from Uganda and moved back to Sudan and brought with them the disease, and the ticks were already in South Sudan. So starting from 2006, there were reports of huge outbreaks of East Coast fever. There was epidemiological surveillance and projects in place, but we didn't see anything happening. We went in 2009, Beppe went to visit, and we went again in 2010 just to look at this situation. Beppe said it was horrendous. He describes this as like a rinderpest picture of the books. There were dead cattle everywhere, and because it was a new disease in a new area, there were calves, adults, everything was dying. Now, in December 2010, finally there was a meeting in South Sudan about the problem. We gave them the options, there is, you can do tick control, but you're in the Nile Basin. So, you have a huge environmental disaster if you start working with acaricides. You can do treatments, but, you're going to be too late because even the people don't recognize the disease. So they will always be late in treating. So, your treatment is going to fail. And you cannot do preventive treatment. So let's go for the vaccination. We had already predicted, because what happens is on the big outbreaks, and that is a typical reaction of all livestock keepers, 2006 and 2007, huge ECF outbreaks in Jonglei State, in Lake State. People running away from outbreaks. They're taking the cattle and going more north because there is no problem, not realizing that they're taking the problem with them. So 2009 and 2010, you had the new outbreaks much more north, and we predicted already that you would have much smaller outbreaks in the years to come. Smaller outbreaks because that area is less suitable for keeping the tick and the dynamics of the disease transmission. But it's a problem. Now, up till now, I would say by end of last year, more than 1 million cattle have died. And you're talking about a 90% pastoralist environment. Why hasn't the international community done something? What they have done now, they have gone for the easiest option, treatment, which we know is not cost effective, is not sustainable, and you're still going to lose too many animals. So, having done this now in Zambia, in Tanzania for so many years, we are puzzled by the attitude of the donor community and the international organizations on why they have to reinvent the wheel all the time. They're looking at local strains in South Sudan. I'm sorry, all the cattle came from Uganda. Uganda is using the Muguga cocktail. You have a perfect vaccine that works perfectly. Why not do a blanket mass campaign, have a disease-free zone, and vaccinate? And the problem is solved. No, they're not. They're going for vaccination because, of course, there are commercial interests involved. They're going for treatment, sorry. Okay, so this is something why? Why is the donor community not realizing that there are solutions available? You do not have to reinvent the wheel. Why is food security still so much a focus on agriculture? Well, we very well know that certainly in Tanzania, certainly in South Sudan and in other countries, food security means protecting your livestock, protecting your village chickens, protecting your small ruminants, and protecting your cattle. Because that is what is food security in Tanzania. We had the big drought with a lot of animals dying, but the Maasais were not particularly starving. because they still had meat and they still had some milk. It was the people in the agricultural sector which were much more destitute. So food security, the donors have to realize that livestock has a much bigger role to play in food security.